Today, my name is Charles Miller. I am the Director of Health and Economic Mobility Policy with Texas 2036. For those of you who aren't familiar, Texas 2036 is a nonprofit, nonpartisan public policy organization, which is a fancy way of saying that we are a think tank. We are focused on kind of meat and potato issues and use data and evidence to drive common sense solutions to the issues facing the long-term stability and prosperity of our state. So wanted to talk today about one of the things that we touched on earlier, and this is the access question, and really wanted to show you and share with you some of the findings from a groundbreaking study that we had done on who are the uninsured. And we know that our state has one of the the worst uninsured rate in the nation. But what we wanted to find out was more about who those folks are, what systems they currently utilize to access care, and what we could do about it. This is our attempt to combine quantitative and a little bit of qualitative data on who our uninsured are, what programs they're currently eligible for, and what we might be able to do. So over here, this green slice here this represents the coverage gap. And this is a group of the population that we hear a lot of talk about because this is the group of people for whom Medicaid expansion would provide new coverage access. And so that's why this group is talked about a lot. But when we look at our entire uninsured population, it's about 15% of that, which means that the problem of our uninsured population is much broader than just Medicaid expansion, which would do great for this group of individuals. What we found was really quite surprising, and that is that if you factor in Medicaid and CHIP eligible children, along with adults and kids who are eligible for programs under the Affordable Care Act, nearly 40% of our uninsured population, so about 2 million people, were currently eligible for a completely free plan, but hadn't enrolled. And so we wanted to find out what those barriers were to enrollment, why folks weren't signed up. And so we did a lot of digging through additional surveys where we asked individuals why they weren't insured in a survey setting, but then dove deeper into that with focus groups around the state and had those in English and Spanish in small group settings, virtual and in person, to really try and get an understanding of what was behind those numbers. But just talking about our high-level survey findings, when we asked people why it was that they weren't insured, here are the reasons that they gave. Number one, not currently employed. Now, not being employed is not a barrier to being insured. There are programs available out there for folks who don't have employment, but this speaks to a perception out there that having a job is the path to insurance. Our next group says, again, have a job that doesn't offer health insurance. And again, this is not actually a barrier to being insured, but it does speak to that perception. We have a number of various other barriers over here. Folks who didn't think that they qualified, which may or may not have been true, again, said that they could not qualify here, didn't know how to get a hold of it, or thought that it didn't have a good value here. Down here, we actually did have about 5% of our uninsured population said that they didn't want or need health insurance. So we sometimes hear people argue about that. That does exist, but it's a very small percentage of that overall number. So the vast majority of folks want insurance, but are either confused or unaware of how to get it. I think that this isn't going to be terribly surprising. It was touched on in the last presentation, but a lack of insurance does lead to delayed care. Folks who don't have insurance are more likely than those with insurance to postpone care. And we can see here that 34% of our folks that we had talked to had postponed obtaining mental health support as a result of not having insurance. So this is a serious barrier. It's even higher for postponing obtaining mental health support for their children, which is a discouraging finding here, but shows the importance of having insurance to being able to access that care that's needed. So when we dug into this, what we really found was that there were 3 big barriers for why folks who were eligible weren't signing up. Again, the lack of awareness of their eligibility and of programs out there is a huge problem. A lot of people were not aware that their kids could be eligible for Medicaid or CHIP, and simply had no idea that they were able to get access to insurance even if they didn't have a job. This was a just real disconnect between the available programs out there and what people's perceptions are. And simple education and awareness campaigns could do a lot to change that. There was also a widespread disconnect between the perception of affordability and the reality of affordability. Now, some of that perception change or some of that perception is based on maybe outdated information. If you go back 5, 6, 7 years ago, insurance was a lot more expensive than it is today. Insurance plans are a lot more affordable due to two main policy reasons, one of them at the federal level and one of them at the state. But again, 40% of our uninsured population was eligible for a completely free plan, and that was not matching in the perception that we heard. When we talked with folks routinely, we heard things like, well, I can't afford $300 a month. There's no way that I'm going to go be able to sign up for insurance for that. And when we looked at their household size and information and kind of mapped them eligibility-wise, the vast majority of these folks that we talked to were eligible for either free or less than $25 a month plans. So that perception, again, this is another education opportunity to raise awareness of the affordability of that insurance. And the last one we see here is that the process of enrollment is just very difficult for folks. They were confused about what documents they would need or how to enter in information. Sometimes there was a discrepancy between what income level they thought that they would need to enter. One of the problems that we saw sometimes was people would enter in their own personal income instead of their household income, and that could lead to different eligibility standards and maybe reduced eligibility compared to what they would have been eligible for had they been turning in the correct information. Also saw that documents or kids' social security numbers, anytime there was information that was needed during that enrollment process that they didn't have on hand, this caused an additional delay. And the options for when that were presented to them during the enrollment process were oftentimes very confusing. So this enrollment process did present kind of an independent barrier due to some clunky user interface, user experience systems, and maybe outdated data systems that could be updated. The sense that we got from a lot of folks was just simply being overwhelmed. One of the things that we were a little bit surprised about was the amount of scam calls or voicemails or text overload that would happen if you were to enroll. We didn't really have a insight in this when we started this project, but when we started talking to folks, sometimes people said that they literally would not go to sign up because they had a friend who had gone to sign up and their phone would blow up nonstop for a week. And they didn't want to have that happen, that was a huge barrier. And this struck us as a little odd, but we heard it time and time again. And this is a real attitude and a prevalent mindset that needs to be addressed. There needs to be regulation and oversight over how that information is being used. But the information overload here was also an independent barrier for folks who did put in their information and then were contacted by these brokers. They felt overwhelmed. And then they would get analysis paralysis. And because there are so many options and so many people contacting them that they didn't have high trust in, they felt overwhelmed, would shut down, and would not sign up. A lot of times the jargon was very difficult to understand. Terms that some of us policy experts might know, like deductibles and copays, were very difficult for folks to understand. And they also had difficulty figuring out, well, what doctors are going to be available in this network? How do I know that this plan is going to be one that actually meets my needs? There's a lot of lack of trust between individuals and insurance companies generally. And this lack of trust combined with the confusion around product offerings meant that a lot of folks simply decided, well, if I don't know what I'm getting and this doesn't seem like a good idea here, maybe I'm not sure about this. So reducing this confusion is hugely important. Now, I wanted to talk also about this specifically in the mental health context. What we saw there previously was a lot of stuff that we got from our survey data. And in that survey process, we didn't see mental health jump out directly as an obstacle. But when we started doing our focus groups, it came through loud and clear. And I think that what we see is that underlying a lot of the reasons cited in our survey data are mental health obstacles. I'm going to give you some anecdotes that really stood out to us during our focus groups. We would, when we were conducting our focus groups, contact 6 people for each one of these focus groups and confirm with them that morning that they would be available and ready to come in and talk if it was in person, or log onto the computer if it was virtual. And routinely, when we actually held the focus groups, we would only get about 4 participants, meaning 2 of them had dropped out. And at first, we were a little surprised by this. But as we went through the process, and we did about 70 of these focus groups, we would have folks who had missed start reaching out to us and contacting us saying, hey, well, I had something come up. Is it possible that I could come in and do this the next day? And this makes sense. We were offering for the income groups that we were talking to, a fairly sizable amount of money for them to join these focus groups. And this could have been a big incentive for them to join. But what we found when they came back and talked to us a lot of times was they would open up and say, well, really, actually, I didn't have anything come up. I was too anxious. I was too nervous. I was just overcome by depression and was unable to physically show up or physically log on and join the Zoom call. And if folks were having this kind of difficulty logging on, again, for a fairly sizable income payout, to just talk about the issues they had with insurance, what kind of barrier is this presenting with a far more cumbersome enrollment process or a job application process? One of these avenues that would be able to get them access to insurance. And so we're now seeing that this is just becoming a vicious cycle where the mental health challenges that people are facing are preventing them from being able to gain access to the channels needed to get access to the insurance, to get the care they need to get better. And so there needs to be some ladder on, some on-ramp onto that so that we can break that vicious cycle. I'm not here to say today that we have a, silver bullet solution here to this problem, but it is something that came through loud and clear that this is a huge struggle, that this is a vicious cycle, and it's something that we need to take seriously going forward. One other access thing that came through loud and clear, and we were a little bit hesitant to report on this, but there is a difficulty, even for those who had insurance in the past, of utilizing that and gaining access to care. And what we heard time and time again was that self-medicating was seen as a much easier option. People were able to access medication, self-medicated, marijuana or alcohol or other substances much more easily than they felt that they were able to navigate our complex, convoluted health insurance and healthcare system. And because of that, people tended to default to this at surprising numbers. So as a result, not only was the affordability and access to the mental health services a problem in and of itself, the complexity of the system presents an independent barrier and decreases the perceived utility of accessing insurance for folks, again, leading to some of these suboptimal self-medication strategies. So again, we don't necessarily have the solution here today, but these were key findings that we found from our study. And when we were talking to folks around the state, these were the challenges that we were reporting. We've been talking with legislators and staff and other stakeholders about ways to reduce some of these barriers, to make the enrollment processes easier, to make sure that folks who have insurance are able to keep it. And some of these strategies you'll hear us talk about and see bills about in the next session, but also wanted to just open it up for any additional questions folks might have about the current state of insurance, the uninsured population, and potential strategies for getting those folks insured.